Hello and welcome to Module 1, Lesson 2, Why Integrate Primary and Behavioral Health Care. This is the first module and second lesson of the Integrated Care for Behavioral Health Paraprofessionals course, which has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation. The purpose of this lesson is to explore the reasons why integration of primary and behavioral health care is essential to achieving the triple aim plus 2 of improving healthcare quality, reducing healthcare costs, improving patients' experience of care, improving provider satisfaction, and delivering equitable care. Key words and concepts to watch out for and pay attention to as we move through this lecture and you read the accompanying module are health equity, neurological, patient-centered care, quintuple aim, and triple aim. Lesson objectives. Students who successfully complete this lesson will be able to describe the history and purpose of the triple aim, discuss each of the 5 aims of the quintuple aim, describe at least 3 ways that mental health and physical health conditions can impact each other, and describe at least 2 ways that integrated care contributes to equitable care. Lesson outline. We'll address these topics in the following order. The triple aim plus 2, i.e. the quintuple aim, behavioral and physical health. We'll talk about the links. We'll finish with a lesson summary, and finally, don't forget to check your understanding with the self-assessment quiz at the end of the lesson. You may take the quiz as many times as you wish. You must score at least 80% to move on to the next module. If you have any questions, don't hesitate to contact your instructor. Part 1. The triple aim plus 2. What is the triple aim? In 2007, researchers from the Institute for Healthcare Improvement proposed that health systems could function better if they focused on 3 different things, and they called this the triple aim of improving the patient experience of care, which included both quality and satisfaction, improving the health of populations, and reducing the per capita cost of health care. The triple aim provided a framework for making healthcare better and less expensive for patients and communities. In other words, it's increasing the value of the care that's provided. Please take a few moments to watch this short video from Dr. Don Berwick, who was one of the founders of the Institute for Healthcare Improvement, and has a tremendous history in making healthcare systems better in our country. He's an amazing person. So please take a few moments to watch this video, and it will help to explain what the triple aim is and why it's so important. So, over the course of time, after the 3 aims had been articulated, doctors and others started noticing something else. They noticed that patients do better when providers do better. And by providers, I encompass physicians and other clinicians, nurses, other support, allied health professionals. So everybody's providing care. I'm using that as an umbrella term here. When we're doing better, when we're the people out there trying to help others and we're doing better, guess what? Our patients do better. Our clients do better. So based on lots of research, a few years after the initial triple aim was formulated, the folks at IHI said, let's add provider well-being as a 4th aim. So to provide high-quality healthcare workers need to be engaged and doing well themselves. When clinicians are experiencing burnout, they're like, yeah, here comes another one. Okay, here's another snotty nose, right? And they're just not engaged. And they're just really too tired to really respond. Patients don't do well either. Healthcare requires engagement. So clinician burnout and poor health have been linked with reduced patient satisfaction, poor health outcomes, and increased costs. So the IHI folks said, well, let's add this as a fourth aim that underlies and supports our other aims. And then a few years later, in 2019, more than 10 years after the initial triple aim was added, the fifth aim was added: health equity. So let's take a moment. We throw about the term health equity all the time, but few of us ever really take the time to think about what that means. But here's some definition time. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. It doesn't mean that everybody gets the equal amount of health care. I might need more, you might need less. But we have an opportunity to get that care if and when we need it. And why was this aim added when it seems like it's a non-clinical aim? Why? Because social drivers of health account for 70% of healthcare outcomes. We know more and more that no matter how good the care is that you receive in a clinic, if you're going home to a challenging environment, if it's stressful, if you don't have adequate and safe housing and food and other access to the things that we need as human beings, our health and well-being is going to be negatively affected. So reducing inequities in health status requires that we address non-medical factors such as housing, food security, financial stability, and environment. Do you know anybody, like maybe a behavioral health paraprofessional, community health worker, peer support worker, who might be really good at doing that stuff? So think about how important you are to what is now called the quintuple aim. So integration of behavioral health care into primary care is a core strategy for achieving these 5 aims, now referred to as the quintuple aim. And that includes your role as a behavioral health paraprofessional. Let's take a minute to look at the complex interplay between behavioral, mental, and physical health. I'm differentiating here between behavioral and mental health because that behavioral health, again, is that umbrella term that encompasses mental health, but so much more. Mental health impacts behavior and health. People living with mental illness are at high risk of developing physical health problems. We know that. And it may be because there's some physiological thing that says if you have depression, then that stresses your body and you're more likely to develop heart disease. I mean, those lines have been tracked. But it can also alter behaviors. Someone who is, again, let's use the example of depression, somebody who's depressed or has some other mental illness, they can find it a lot harder to engage in healthful behaviors like eating well, exercising regularly, even maintaining personal hygiene or a clean home. Those things can be a lot harder for someone with mental illness. So that can create this cycle of ill health hinged upon, with behaviors as that hinge, that includes both the body and the mind. Conversely, physical health impacts mental health. People with physical health problems are often affected by mental health or behavioral disorders. Diabetes has been linked with depression, as has chronic pain, very strongly. Those who survive a life-threatening event such as a heart attack or sudden cardiac arrest may struggle with depression, anxiety, and other mental health issues. I know a woman who had a heart attack at age 35 out of the blue. Turned out she was just genetically predisposed. And when I knew her about a year later, she was a single mom, had a young daughter, And she was extremely anxious and had not been getting treatment for anxiety. Once we got her lined up with treatment for her anxiety, a lot of things resolved. But after having experienced sudden cardiac arrest at age 35, she was understandably anxious. Neurological issues are a great example of how complex the interplay between physical and mental health can be. Let's stop for a moment to define neurological, because it's one of those big funky words that's thrown around a lot. Basically, it means that it has to do with the brain and the nervous system. So anything that has to do with that part of your body that involves nerves, whether it's nerves that help you to feel or to move, any of that electrical wiring, that's a neurological issue. So we can see causes of neurological issues like trauma. Somebody gets in a car wreck, they have a fall, they have a blow to the head, and they end up with TBI or other kind of neurological trauma. Tumors can grow and impact nerves. Viral infections, we'll talk more about that in a minute, and other causes, but those are some of the big ones. And of course, just plain cognitive decline associated with degenerative diseases like Parkinson's. So the results of those are complex medical and neurological disorders. Car wreck, damage to the spine, someone might become a paraplegic or a quadriplegic. With it comes a whole host of medical, physical disabilities and other issues. That traumatic blow could lead to mental health issues if a certain part of the brain is damaged. So when we think about that, I wanted to talk about neurological issues, not because they're the only one, but they're a great example of how intertwined medical and physical health can be. And you can see that just addressing one aspect of that, not to mention somebody might be slightly, have difficulty adjusting to life changes, such as suddenly being in a wheelchair after a car wreck, that they're complex and they need to be addressed from all fronts. Mental health and substance use. More than 1 in 4 adults living with serious mental illness also has a substance use problem. Sorry for the verb tense there. That is an astonishing number. It means that so many people who we see day in and day out are essentially self-medicating with substances. People who are especially vulnerable are those who are experiencing depression, schizophrenia, anxiety, and personality disorders. We have many substances that are widely and freely available in our country and in our community, ranging from alcohol to street drugs to even prescription medications. But people with these conditions are especially vulnerable to misuse of those medications, of those drugs, as a way to, and substances, as a way to try to control their disease. Sometimes those things happen in the mental illness and substance use can be really, really closely intertwined. For instance, some illegal drugs can cause people with an addiction to experience 1 or more symptoms of a mental health problem. So you were fine before, you take the med. Happened to my brother. He took a bad hit of LSD. I mean, we're talking 50 years ago. I'm disclosing my age here. And he ended up being diagnosed with bipolar disorder afterwards. The drug did something to his brain. So it is not uncommon. People with a mental health problem may misuse drugs and alcohol as a form of self-medication, as we just talked about. And then finally, underlying causes of mental health disorders may make people more vulnerable to substance use disorders. We know that some people are more likely to become addicted to as common a substance as alcohol than others. And these underlying causes can have to do with the brain, genetics, exposure to stress or trauma early in life. There can be many different causes for that. But again, these interactions involve the complexity of how our brains, as physiological things, our minds as whatever they are, our emotional and mental health, and our bodies interact. Some more key facts that can point to the real importance of integrating care. 17 million U.S. adults experience both mental illness and a substance use disorder in 2020. Up to 80% of people with a behavioral health disorder visit a primary care provider at least once a year. And many of those people are never diagnosed in the primary care setting. And some people would rather seek help from their primary care physician than a specialty mental health provider. Again, there's stigma associated. So that stigma can prevent people from walking into the building of a mental health provider, but they're more comfortable going in to see a primary care physician with whom they have a relationship. The risk of heart disease and or diabetes is up to 2 times higher for people with a mental health disorder compared to individuals without one. That's some hard facts about the link. So if someone's being seen by a behavioral health specialist, they also need to have that follow-up from the primary care person who is aware of the mental health condition so they can screen them appropriately and hopefully prevent subsequent medical conditions. And again, people with depression have a 40% greater risk of developing cardiac disease, hypertension, stroke, diabetes, metabolic syndrome, or obesity than the general population. And people with mental illness are more likely to engage in behaviors that don't support health, like being physically inactive, smoking, drinking excess alcohol, having trouble sleeping, and having poor diets. So that link that we can really address is the behavior in a lot of different ways. I wanted to bring up COVID-19 and integrated care. I know everybody's done with the pandemic, but the pandemic's not done with us. One of the things that we've been learning over the last 3 years about infection with the SARS-CoV-2 virus, the coronavirus or COVID-19, is that viral infection can lead to many different physiological problems. Neurological damage occurs in an estimated 1 out of 20 people who develop COVID-19. It might be actually higher than that. It might be as high as 20 out of 100. The SARS-CoV-2 virus sometimes attacks the brain itself. Sometimes it causes microclots and inflammation that damage tissue, so there's secondary damage to the brain. There's been Iwasaki, who's one of the leading researchers in viral infection and has really been focused on COVID, has identified 6 ways that COVID causes neural damage. So here's a viral infection causing neurological damage that then leads to physiological and cognitive and other issues. So COVID-19, as a result of this, may lead to behavioral and mental health symptoms ranging from anxiety to dementia. I've spoken with several mental health providers lately who've said, everybody said COVID is coming into my office and their anxiety is through the roof. Well, when we start looking at the physiology of it, their brains are inflamed. So, of course, they're feeling anxious. Their brain is saying, hey, there's something wrong, folks. Pay attention to me. And then, of course, we can have permanent brain damage, causing problems with movement and with other parts of our physiological being. And then there's another layer of complexity. Right? When everything shut down, many people experienced anxiety, depression, and other mental health problems as a result of some of the interventions put in place to slow the spread of disease. Social isolation, for instance, has been strongly linked to negative health effects, including increased risk of premature death and dementia. So it's really hard to tease out all of these effects, but we know the virus itself causes neurological damage in multiple different ways. We also know that the stress, the limbo, when is it ever going to be over, the shutdowns, all of those things, the isolation, also have an impact. So once again, that complexity, and in the end, the answer remains delivering comprehensive, integrated care to those who need it that addresses all of those physiological and mental health issues. Part 3, Health Equity and Healthcare Integration. Health equity and healthcare integration they're part and parcel of the same thing. Integrated care is an essential component of equitable care. Again, returning to our definition of health equity, it means that everyone has a fair and just opportunity to be as healthy as possible. The image on the right demonstrates the difference in the concepts. Everybody wants to pick an apple, right? So if we give everybody the same size step stool, then the tall guy gets the apples. The medium guy or gal can get the apple if they jump, but the short person just can't get there at all. In the equity model, we give people just the literal boost that they need. So the short person might need a little bit more of a boost to get the apple than the tall person, but we share our resources, so we have the same amount of boost, but the person who needs it more gets a little bit more. No matter how good, cost-effective, or patient-centered the care is that a person receives in a clinic, their health is in jeopardy if their life outside of the clinic is filled with challenges such as unstable housing, food insecurity, or contaminated air. Years ago, I wrote a rather big article based on research done by folks at George Washington University, where they had gone into a couple of really big community health centers, federally qualified health centers, and interviewed people and worked with clients and providers. They found that fully 80% of the people visiting that clinic in these they were in low-income urban settings, I should say, would have benefited more from seeing a lawyer than seeing a doctor in terms of their health. That's how profound the impact is. People who belong to communities that have been marginalized because of disability, gender, ethnicity, race, or other reasons are more likely to experience multiple chronic illnesses, including physical and mental health problems. Not because there's anything wrong with those people, but because the stresses of marginalization have physiological and mental health impacts. So when we integrate care, we have a chance to actually address all of those factors and make sure that all of the person's needs are addressed comprehensively. Equitable care requires that healthcare team members work in a coordinated way across primary behavioral and specialty care, social services systems, both private and public health. And that's really what integrated care is. But when healthcare and social services are provided piecemeal, in an uncoordinated and fragmented way, those underlying inequities actually become greater. So when behavioral health is integrated into primary care, healthcare teams can better help patients address their full spectrum of needs and build on their strengths. It's a strengths-based model that we always want to start with. People are better able to benefit from the health care they receive when they're able to feed their families, go home to a safe environment, when they get health-literate communications that they can understand, and they're financially stable. It's just a lot easier than going home to live under the ditch. So integrated care, in its holistic approach, can help reduce disparities in health. And the role of the paraprofessional in helping to address all of those non-medical factors, and also being able to just say, been there, done that, here's how you process through this, is just essential to equitable care through healthcare integration. So let's recap. The triple, or now quintuple aim, The Triple Aim is a framework developed by researchers from the Institute for Healthcare Improvement to improve the way that health systems work. The three initial aims of the Triple Aim are improving the patient experience of care, including quality and satisfaction, improving the health of populations, reducing the per capita cost of health care. A few years later, IHI researchers added provider well-being as a fourth aim. To provide high-quality healthcare workers need to be engaged in doing well themselves. Health equity was added as a fifth aim in 2019, and now the IHA framework is referred to as the Triple Aim plus 2, or the Quintuple Aim. Lesson summary: the link between behavioral, mental, and physical health. People living with mental illness or behavioral disorders are at greater risk of physical health problems. People living with physical illness are at greater risk of mental health problems. The COVID-19 pandemic illustrates the complex relationship between mental and physical health. Health equity and integrated care. Equitable care requires healthcare team members work in a coordinated way across primary, behavioral, and specialty care, social services systems, both private and public health. And integrated care is an essential component of equitable care. Thank you for your attention. This lesson has been brought to you by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation, with funding from the Health Resources and Services Administration.